The Trump administration announced major progress in understanding the root causes of autism with studies that showed a possible increased risk linking the use of Tylenol in women who are pregnant. Joining us now to discuss is Dr. Elizabeth Munger, Senior Fellow of Pediatric Education with the Independent Medical Alliance. Good morning to you, Dr. Munger. Great to see you.
Yeah, thank you for having me on.
The Trump administration, said on Monday, pregnant women should stop taking acetaminophen, Tylenol, because of this research. What's your thoughts on this? What are the risks?
Well, I became aware of this problem about 2 decades ago. We had some data that showed that acetaminophen was associated with autism, and there are plausible reasons why this might happen. For example, children with autism have problems with certain detoxification pathways, the sulfation pathways, which are known to affect acetaminophen metabolism. Also, women in pregnancy are low on something called glutathione, which is very important for detoxification and as an antioxidant, and Tylenol reduces that also. And then there was also research that certain toxic metabolites of the Tylenol itself could actually affect the fetus in utero. So as a result of that, I have not been recommending acetaminophen since about 2003. The research is mixed. There are over 6,000 studies looking at it. Many say there's an association, some do not. I think it's very important to look at confounding factors and also to really look at what the plausible mechanisms might be. In my practice, my rate of autism was 1 in 297 at a time when the national rate was 1 in 50. So I think that's kind of a proof of concept that limiting Tylenol, which was one of the things that we did, could actually be as helpful.
It,
Uh, I don't want people to think acetaminophen is the only
correct.
contributor or cause. Yes.
I was going to ask you about that because even just a cursory look online, there's one thing that many doctors, many scientists can all agree on, and that there is a genetic component, correct, that can make a child more prone to develop autism.
Yes. So, despite the relatively small number of children with autism who have a classic chromosomal defect, there are a lot of genetic changes. We call these SNPs, or single nucleotide polymorphisms. These are small changes that might affect the inflammatory pathways or the immune pathways or the detoxification pathways. And we can now identify this with blood work to see which children might be at higher risk. The other thing that I was so glad to see during the hearings was that the administration talked about listening to the parents,
Mm,
because I've evaluated over 600 children with autism, and about 23% of the parents identified the MMR vaccine as a trigger to their child's regression. That doesn't mean that that's the only trigger, and
correct.
I just think that we need to take this very seriously. And in the past, parents, when they brought up the issue that vaccines might be involved, were often gaslighted or told by their physicians that they were crazy or just overly anxious. So I think the administration signaled a change in this regard. We got a lot of information from parents back when I was medical director of the Autism Research Institute. They actually helped set our research agenda and gave us insights into therapies.
And there's also correlation and causation, as you know. So there's still a lot of research that still needs to be done. But tell us about, the recent hearings on the topic and the changes announced in the vaccine schedule. What did you think about that?
Sorry, you were frozen for a bit on my screen.
Or
Tell me about the recent.
the vaccine schedule, the vaccine,
Yeah.
because you were just talking about that, because you still would recommend, obviously, MMR, correct?
Yes, but I always gave it at a later date because of some research that the CDC did, especially that showed that African American children seem to do worse in terms of risk of autism if it was given early. So I gave MMR after 3 years of age. I gave to African American children, I gave it at 2 years of age for Caucasian children. But there seems to be a shift from this one size fits all strategy of just following the schedule no matter what, to actually look at individual risks. And so the recent American Committee for Immunization Practices, is moving away from the recommendation to give hepatitis B at birth, for example, and is suggesting maybe do it after a month, or maybe people are suggesting even later. Um, so they're reconsidering these sort of standard recommendations to take into account parental choice, individual risk factors, and individual benefits to particular patients. And I think that's a move in the right direction.
Doctor, great talking to you this morning. And to learn more about this issue and some resources that can be made available to you, all you have to do is visit imahealth.org.